Can you answer this USMLE cardio question? A 34-year-old woman is admitted to the emergency department following an MVC. She was an unrestrained driver. On arrival, her temperature is normal at 97.2 and heart rate is 128. That is tachy. Anything above 100 is tachy. Blood pressure is 92 on 50. That is shock. So remember, anything that is 90 on 40, 80 on 50, any blood pressure that makes you think, oh my gosh, this patient's dying, that's probably a shock question. Respiratory rate is 24, which is high. Anything of 20 is high. And then physical exam reveals a distended abdomen with severe tenderness. Fast exam shows free fluid in the abdomen. So what type of shock are we thinking now? So I'm thinking hypovolemic shock. This patient clearly is bleeding into their abdomen. So they're losing a lot of blood in their abdomen, and this is causing hypovolemic shock. And it's asking which of the following sets of hemodynamic changes is most likely in this patient. So let's start off with cardiac output. Cardiac output is how much blood is leaving the left ventricle. And in patients with hypovolemic shock, do you think we have any blood flow coming to the right side of our heart, let alone the left side of our heart? No, so cardiac output in hypovolemic shock is gonna be really, really low. So let's eliminate every answer choice with an increased arrow, which is B and E. Moving on to PCWP, what is that? That is the pressure in the left atria or the preload in the left atria. Like we said, there's no blood flow coming to the right side of the heart, so do you think there's any coming to the left? No, there's not. So PCWP is going to be what? That's also going to be decreased. So let's eliminate any answer choices with the increased arrows there, which is C and B. SVR, what is that? That is the compensatory process for a lot of these types of shock. And pretty much anything that is not distributive shock is going to have an increased SVR. So let's eliminate any answer choice with a down arrow, which is D. That leaves us with one answer choice, which is A, but let's go over CVP. Remember, CVP is what? That's the central venous pressure, so that's how much pressure or preload is going to the right side of the heart. Like we said, in hypovolemic shock, we have no blood flow at all, we're losing it. So do you think there's any blood flow coming back to the heart? No. So CVP is going to be decreased.